Thank you so much for joining today's webinar, which is entitled Tools to Mitigate Work Stress and Prevent Burnout for Healthcare Providers During COVID and Beyond. I'm Laurie Udesky. I'm a staff reporter with ACEs Connection, and I'm also the community manager of ACEs in Pediatrics. And ACEs Connection is a social network with nearly 50,000 members working across the country on building ACEs initiatives to solve our most intractable problems. The webinar will introduce healthcare providers to the Community Resiliency Model. It's an evidence-based method of managing traumatic stress, preventing burnout, and building resiliency. And this is a 1-hour ACEs Connection webinar that's co-sponsored with the Center for Care Innovations. It's the first in a series focusing on wellness and healthcare providers. And I'm going to let you know more about our next webinar that's coming up in a week. And I will put that in the chat. So our webinar today is going to answer the following questions. What is the Community Resiliency Model? What is the science behind CRM? How can CRM be used in the course of a fast-paced day? And how can CRM transform the work environment for healthcare providers? For today's webinar, our 3 panelists will speak, and then we'll have a question and answer period during the last 15 minutes or so. Our first speaker is Linda Grabbe. Linda Grabbe is a clinical assistant professor at Emory University School of Nursing and a board-certified family nurse practitioner and psychiatric mental health nurse practitioner. And she is a trainer in the Community Resiliency Model. She is going to explain what CRM is and the evidence-based research behind it. Thank you, Linda.
So thank you, Laurie and Gail and Allison for making this possible. And thank you all for calling in for this. I think it's gonna knock your socks off. So the Community Resiliency Model was developed by Elaine Miller-Harris and her colleagues who are at the Trauma Resource Institute. So all 3 of us panelists today were trained by Elaine Miller-Harris. And some information about CRIM. So it emerged out of several events, environmental disasters in different corners of the world, where there were some psychotherapists who were trained in body-based techniques for self-regulation. They could not do therapy, there wasn't time, but they could teach people some self-regulation skills that turned out to be enormously helpful and reduced PTSD subsequently. So this model seems to work across multiple cultures. It's currently in 100 countries, and any age is open to it and can be receptive to it. And I've taught groups of police officers, incarcerated kids and pregnant women, and lots of doctors and nurses, and it seems to be acceptable to just about anyone. Some of the skills that you'll learn you're already doing, but this sort of packages in it in a very convenient way. So the cornerstone concept is the resilience zone. This is our bandwidth of stress tolerance. It feels good to be in this resilience zone, but we could be anxious or sad and be still in our resilience zone, which is where we can get along with people and get our jobs done. This wavy line could represent mood, but also it really reflects what's going on in our nervous system. CRIM is biologically based. So we have the upswing, which is sort of the energy, which comes about because of this sympathetic nervous system. And then we have recovery because of the parasympathetic nervous system. So throughout our day, we have this expenditure of energy and then restoration or recovery. CRIM works to put us automatically in this recovery state which is over time is going to widen the resilient zone. And if you should have the misfortune to get bumped out, which happens to all of us, you have techniques to get back into the resilient zone. Our zone is going to be narrower if we are tired or hungry or in pain. And things happen that throw us out of kilter. And here you see there's this dysregulation. We have either too much of the sympathetic discharge, the accelerator, or too much of the brakes, the parasympathetic. And we can be thrust right out of this resilient place, this internal state of balance, into a state of sort of edginess, irritability, and panickiness, anxiety. Alternatively, we can be thrust into an excess parasympathetic state with sadness, depression, exhaustion, fatigue, and numbness. And these are kind of universal expressions of just states of distress that we all get into no matter what culture we come from. Well, the problem is we can get stuck out there. We may have trouble not getting back into that place where we feel more resilient. It doesn't feel good, but it explains the tremendous number of our behaviors in response to stress and trauma. For example, engaging in high-risk behaviors, maybe drinking too much. It's an attempt to cope. So right now, I'd like to ask you a question, and I'd like you to think about what brings you strength. For example, right now, under the current conditions, what uplifts you? What helps you get through hard times? And if you think for a moment, many people will name their, will say it's my dog or my husband or my family or my friends or this place in nature. So, and then I would invite you, as you think about that source of strength, what do you notice happening in your body? And that's just a preview of the skills that Dr. Lawson is going to talk to you about in just a minute. The fact is that our sensations may actually precede our awareness of emotions or even sort of thoughts of how we're feeling. So this was a piece of research done on 2 continents, and the subjects were shown images or text which elicited these emotions across the top. And they registered on a computer areas of energy or activation, which is the yellow and red. So look at happiness. It's this glowy feeling all over the body. And in love too, but look, in anger, we have this lit up as well, but for different reasons, fight and flight. The black is neutral and the blue is no activation, no energy. And that is so amazing to see for depression and sadness. And this is when you can't get out of bed in the morning. All of this happens in a part of the brain called the insula. It's like the hub or the hub of neural connections from the brainstem and the limbic system and up into the prefrontal cortex. So this area is responsible for a lot of really important things like empathy, social interaction, emotion regulation, sense of self, and also interoception. So this area tells us if we're too cold or we need to eat or we need to sleep or we need to go to the bathroom. And those sensations are all related to our survival. And so when we have the links up to the prefrontal cortex, we get all parts of the brain working together and good mind-body connection. So this area is where you sense into the body. So if I'm feeling anxious, where do I feel it? Across my shoulders? I'm thinking about it. Maybe I'm naming it. Is it a twitchy feeling? And to do that, I'm bringing in the prefrontal cortex and I'm bringing my brain and it's putting me back into my resilient zone. Research is new because this is a new model. We did the first randomized controlled trial here at Emory University It was with nurses who were divided up into either crim or nutrition groups. They didn't know what they were getting. And the crim group demonstrated increased well-being, large effect size actually, and this was published, and the citations down here: increased resiliency, decreased secondary traumatic stress, and physical symptoms. And they were using the CRIM skills, which you're going to get a little overview of, in scary, stressful, chaotic, during situations with dying patients, during codes, in a difficult shift. And so they were able to use the skills immediately in really dire clinical situations. We also did a similar kind of thing, not with a control group in a drug treatment center. The women were so receptive. It's like all of a sudden they understood why they did some of the things they did. So they had increased well-being and decreased physical symptomatology. And these are the somatic symptoms that are accompany stress and trauma. This comes out in our headaches and problems sleeping, and decreased anxiety. And these are some of the things that they said. They said they felt more hopeful, more like they had a purpose, different way of being alive, a higher level of self-awareness, and noticing highs and lows. She may be talking about the high and the low zone and why I act the way I do. And our next speaker is Dr. David Lawson.
Thank you, Lindy, for that introduction. Thank you all for being here. Look forward to going over some of the actual exercises so that you can get some experience of what this is like. This is to show two things really on this slide. One is there is an app. It's called the iChill app. Apparently there are other apps that have the word chill in them, so you want to be careful to get the right one, which is this one here that's shown in the picture. This is dictated by the founder of all this, Elaine Miller Carras. And so it's something you can go to after this and get more information and actually practice the exercises. All right, what are the skills? The central one here is tracking, and that's in CRIM, keeping track of sensations, noticing sensations. We'll talk more about that, but that's central. After tracking, if you find unpleasant sensations, you can go to these other techniques like resourcing, which Lindy already mentioned, grounding, which many of you already know, help now, which we'll talk about. And then there are others that we won't have time to talk about. But if we can go to the next slide, tracking is reading sensations. It's noticing or paying attention to what's happening inside your body at the present moment. And then second, putting a value on it. It's pleasant, it's unpleasant, or neutral. And then what we're going to want to emphasize over time is how to stay with sensations that are pleasant or neutral, and pay attention to what happens to you on the inside as you're paying attention to these things. So next slide, please. Now, so what happens when that lightning bolt strikes? A lot of things happen. Our thinking, for instance, may be altered. We get dissociated, we get forgetful, we make poor decisions, our thought processes are altered. Our emotions may become altered in ways we don't like: rage, fear. This was talked about, depression, guilt. We have spiritual reactions as human beings. A lot of this revolves around faith, loss of faith, increase in faith. People respond differently to these things. But what we're going to focus on is what Lindy was talking about, the physical reactions, the sensations that we have: numbness, pain, rapid heartbeat, rapid breathing, tight muscles. And again, the emphasis here is on the sensation and what you can do to help calm the unpleasant sensations, bring you back into a place where you are experiencing more pleasant things and feel calmer on the inside. And a lot of the goal of this is to avoid the behavioral consequences of some of these other changes, like tantrums, self-injury, eating too much, drinking too much, and then the effects that these things have on your relationships. Missing work, for instance, becoming overly dependent, irritable, clinging, regressive, all these things that we want to avoid. But the center of all this is going to be sensations. Next slide, please. And so, well, we need to think about sensations because we often don't think of sensation words. Now, as healthcare providers, many of you are used to the fact that we have taste, smell, sight. No, and you know about that. But for some people, we have to kind of introduce them to the idea that these are separate and that you can pay attention to them. And that you might notice, for instance, if you're trembling, are you trembling rapidly or is it kind of a slow tremor? If you're breathing, we've talked about that, paying attention to breathing, paying attention to your heart. If you're touching things, does the surface feel rough or smooth or thick? Does it feel like thin, like paper? And these are things that you won't notice so much as a result of trauma, but they're things that can help you to come back into a better place. So next slide, please. And so let's talk a little bit then more about resourcing. And we'll do an exercise to see or to help you, I hope, experience what resourcing can do for you, and also to see that it only takes you a few minutes, which is very important as you're going through a busy day. Now, what is a resource? It's a person, place, thing, activity. It can be a memory. Can be a part of yourself, like your strength or you're good in math, anything of that sort that helps you to feel calm, safe, peaceful, strong. And of course, you might need to feel different things at different times. You might want different resources for different times. But that's what a resource is. It's something that will help you come back into the resilient zone. So next slide, please. And it may be childhood memories. It may be your ability to coach people as well as to play. It may be your faith. Important to say, for some people, it may be imaginary. I mean, you may not have, I think most of you probably do, but you may not have actual places in your memory that can help you like this. And so you may actually have to make them up. And sometimes people do. Next slide, please. But all right, let's do a resourcing exercise now. This is going to take about 3 minutes or so. And I want to invite you now just to sit if you're sitting, stand if you're standing, but get comfortable. Just relax a little bit. I'm asking you for 3 minutes of your time to demonstrate something. You may want to close your eyes. Take a deep breath to sort of settle in. And then out of all those choices that we've given, choose just one thing that gives you a feeling of calm or peace or comfort. Think about what that is, or who that is, or where that is. And as you're thinking about it, try to think more about the details. What are you hearing? Are there sounds associated with this? What are you seeing? What are the colors? If it's a person, what are they wearing? If it's a place, what are the colors that you're seeing in that place? And then think a little bit about what you feel. In that memory, are you standing someplace? Are you sitting someplace? Are you walking? You know, what senses do you have? What's the temperature? Is it moist or dry and hot? What do you smell? Might be smell of food, might be the smell of fresh hay, and anything. But what do you smell? And if there's a taste associated with it, what are you tasting? What is that taste? See if you can call it back into your memory. And as you're thinking about this resource, pay attention to what happens on the inside of your body. Like as not, the sensations you're having are at least neutral and we would hope pleasant. Pay attention to them. And if you can, I'm going to stop talking for about 15 seconds, and I invite you just to pay attention to what you're feeling on the inside as you think about this resource. All right, now we will just slowly come back into the presentation. Open your eyes when you feel like it. Stretch a little bit, whatever. And now welcome back. Welcome back to the world. I hope that was a good experience for you. And I hope that it will give you some feelings that will persist. If this was a longer presentation, we would stay with this longer, but my goal is to introduce you to these in 15 minutes. So let's go to the next slide, into the next skill. Now, this is grounding. Now, grounding is very much in the present moment. Now, resourcing, you notice, takes you out of the moment. It takes you to someplace else. A wag once said, any place but here. No, but it takes you away. Grounding brings you into the present moment. And grounding is exactly what it sounds like. It's gravitational security, that you know that the world is solid, that there are solid things around you, and you have a sense of self in relationship to present time and space, not worried about the past or the future. Next, please. And then, so what is grounding? It can be walking and paying attention to your steps. It can be rubbing your hand on your desk like I'm doing right now. It can be sitting in a chair or kneeling on the ground and being aware of your contact with the surfaces that are holding you up. In the nursing study that Lindy was talking about, one of the nurses talked about going into a difficult situation and counting the steps as she went in, and how that would help her deal with the situation. Next slide, please. And so we'll do a little bit of a grounding exercise. And again, I want you to be comfortable. But as you're sitting or standing, just begin to pay attention to how your body is making contact with the chair or with the bed if you're lying in the bed, or a wall if you're standing against the wall. And then notice the sensations that are pleasant or that are neutral. You might want to notice what's actually holding you up, what part of your body is most supported. If you are aware of uncomfortable situations, then shift. Move around a little bit. Notice the change. Slowly scan your body and bring your attention to all the sensations that are pleasant or neutral. And then remember those sensations as we get ready to end. And again, I'll give you 15 seconds just to pay attention. All right, now we come back into the room. Welcome back. All right, what do you need to do if you need to do something quickly? The next slide, please. Basically, these are things that you know, name colors that you look at, count backwards from 20. That would frustrate me, but some people might like that. Notice surfaces of things. These are things you can do immediately. All right, next slide, please. So basically what we're saying, identify sensations of stress, then try to deal with them. Next slide, please. This is it in a nutshell. You read your nervous system, then you do exercises that get you back to resiliency. And then next slide, please. What you pay attention to, if you pay attention to these pleasant sensations, even if you get old, they can grow. Next slide, please.
You have about a minute left. I'm sorry to interrupt.
No, that's fine. I'm almost done. And so if you find, thank you for that. If you find any of these things helpful, we invite you to consider how you might weave them into your daily routine. And next slide, please. And what I want to do is just thank you for giving us your time and your attention. I hope you see some value in these. They're exercises. So if you can take 5-minute segments of your day to practice some of these, they'll be more available to you when you actually need them, when the heat is on. And they can also help you widen your resilience. So thank you very much for your attention.
Thank you so much, Dr. Lawson. That was really edifying. I want to invite everybody to put any questions that you have into the chat. And we will be having a Q&A at the end of the presentations. So please go ahead and start putting your questions in now. I will cue people by playing a crystal sound. And so if you hear that, anyone else, you might enjoy it, but it's also to let our next speaker know and that time is about up. So it's not too interruptive. With that, I'd like to introduce everybody to our next speaker, who is Erlyn Navarro. He is an LCSW and Doctor of Management and the Manager of Community Programs and Services at St. Mary's Health Center in Apple Valley, California. She is also a certified Community Resiliency Model teacher. She will talk about her step-by-step approach to implementing CRIM organizationally in a clinical setting. Erlyn?
Thank you. Welcome, everyone. So I am honored to be on this panel, actually. Everyone else on this panel has been a CRIM teacher for much longer than I have been. Actually just completed the training in February of this year. And then, wouldn't you know it, a month later needed to pretty quickly implement the CRIM skills and be able to use it. So what I want to share with you is sort of in April or March, actually, had an opportunity to be able to help the hospital. So I work in our community clinic, and I have been with St. Mary Medical Center for 22 years. So I have a lot of relationship with the other leaders in the hospital. So had an opportunity to help, and I was asked to be deployed to work in the hospital to help with our caregivers or our hospital staff to deal with their stress. And so basically was given a carte blanche opportunity to design whatever that looks like. Our VP of Mission Integration was interested in having that boots on the ground person who can help with the staff. And so, and then again, like I said earlier, luckily I just completed this CRIM training. And so my vision for it was I wanted to be able to embed CRIM into the culture of our organization. I didn't want it to be a Band-Aid fix for the pandemic. And that, as you've heard from Dr. Lawson and Dr. Grabbe, a lot of the principles of it really fit in terms of what was already going on prior to the pandemic. You know, we have in our employee engagement survey, a lot of report of high burnout, stress. And so this was something that our administration was already grappling with. How do we do that? And so I really found that opportunity to be able to say, hey, you know, let's try this and figure out how we can teach these skills to our staff and be able to do that. So I wanted to just kind of, and just for the purpose of background, as Laurie mentioned earlier, I have a doctorate in management and my dissertation was actually on organizational culture change. So just for the purpose of letting you know, that's the lens that I work off of anyway, you know, so from a systems theory perspective, you know, how do we change the whole system and not just one portion of it, not just the individual. And so in this case, wanted to be able to change the belief on how people cope with stress and being really looking at it from a community resiliency that, you know, again, we keep hearing people say we're in this together, but how are we in this together? You know, what can we do to help each other out in this process? And so, and then Laurie actually also asked me when we were talking about this, well, how would you know that if CRIM is already in the culture? So I wanted to add this slide in the sense that really when you're looking at, you know, when we're looking at a culture of an organization, there's some underlying things that we don't see, which is in the beliefs, our attitude, our shared understanding. But then there's also the things that we can see, the artifacts, the rituals, the symbols. And so trying to address them at all of those different levels takes years to be able to make that transformation and change. And so, so with that, I just needed to make some baby step and be able to be strategic about it, obviously, and clearly the hospital had the motivation to change. You know, we needed to do something pretty quickly to address how we're going to cope with this pandemic and be able to give our staff, in this case, during this time of anxiety, that psychological safety net that they know, like, yes, we're here to help you. As I mentioned earlier, organizational culture change takes years. And so the other approach that I took is really using Malcolm Gladwell's tipping point. So if you haven't had an opportunity to read this book, highly recommend it. And so just some simple concept just in terms of, and I'll kind of walk you through each of the different steps on what I did to use Malcolm Gladwell concept on tipping point. So there's this whole idea of the stickiness factor. And so how do I package CRIM or Community Resiliency Model so that people will remember it, kind of really buy into it and understand that whole piece? And I think that in this case, Dr. Grabbe and Dr. Lawson already mentioned, you know, it's pretty simple. And the way it's presented, it's simplified, you know, so it's not therapy, it's not, you know, although I am a licensed clinical social worker, which is why I was asked to help with our staff and being able to use that. And so the other piece that's really essential, and again, I'll spend a little bit more time talking about the law of the few. So really identifying who are some key people that we needed to get their buy-in. And so Malcolm Gladwell talks about the connector, the maven, and the salesman. And I'll explain to you kind of how I've identified those people for us to be able to do that. And then when we're talking about the context, you know, he's talking about, you know, being able to change people's behavior based on changing the environment. So there's a couple of different ways on how I interpreted this piece of it. And you'll hear it as I talk about it and how I, you know, kind of the approach that we are taking here at our hospital. So just to help you understand kind of the concept of tipping point. So really, building a momentum of making this change. So in this case, I was trying to create a movement of CRIM movement here at our hospital. And so building that momentum takes a lot of work, right? So it's like that uphill battle. A lot of times that's what it feels like. And so we needed to get enough mass and buy-in, to get to that tipping point where it's like, okay, we get the buy-in, now we're like really into this, and it's something that it's going to stick and be a part of our organization. So we're not there yet at this tipping point. So I'm still kind of that uphill battle. Again, remember, we just started this in April. And so we're just still working at it in this case. So I wanted to just share with you kind of what happened, all the step-by-step. So when they asked me to be a part of the command center, so then being able to attend those emergency preparedness or command center, kind of the day-to-day, what's happening, how many COVID cases do we have, staffing issues, supply issues. And so it was helpful for me to be a part of that command center to just kind of understand where some of the hot spots are in terms of who's struggling, which department, and where the help was needed. And then rounding with the leaders and the staff as well. And I actually also, so this is not in any order. So when there are opportunity to cross promote. So for example, we've had a lot of donation of free pizza, free sandwiches. Our executive leaders were doing rounds to give out water, to give out. So any of those opportunities, I partnered with them and went with them to make those different roundings so that, they're there to do kind of part of helping the staff be supportive. And then I was just there to be available to let them know about the CRIM classes or to meet with me one-on-one if they wanted to learn about CRIM or learn about resiliency skills. Of course, I'm using CRIM because that's just kind of how I talk about it. But when I talk about it with the staff, I'm talking about stress management tips and resiliency skills. So really simplifying. And so, because then that is what resonates with them. Got myself invited to some staff meeting and huddles. And so in those huddles, I asked them, like, just give me 5 minutes, 10 minutes. And so I would do some of those short exercises that Dr. Lawson was talking about, just to give them a preview and be able to kind of give them some tips. And then, of course, encourage them to come to, attend the class. They also gave me a small room as one of the consultation room outside the OR as a way for people to just walk in if they wanted to come see me. So again, I was that boots on the ground EAP, employee assistance person temporarily. Had information in our hospital newsletter about different tips on stress management, also put in again, my availability. And then the key part is really recruiting CRIM guides. And so that's kind of what I will be talking about a little bit more, which is part of that whole tipping point that we're talking about. So here's that law of the few of looking for connectors. So these are people who know a lot of people, and you know them at your hospital or your clinic. They just have that knack for getting to know people, and people trust them, people like them. And then there are people who are the mavens, or they just are the data banks basically, and they just know a lot of things like of what's going on and all of that. And then there's some people who are the salespeople. I call them the woo, right? So from a StrengthsFinder point of view, woo is winning over others. So they're the salesmen and being able to kind of persuade people, hey, this really works. And so for me, being able to identify who are these connectors, maven salesmen in our organization that I can get their buy-in and then give them a preview of what CRIM is. So basically gave them 1 hour session if I could get their time either in a small group or just one-on-one. So before I get into that, like who I invited to be a CRIM guide. So CRIM guide, the concept of it, as Dr. Grabbe mentioned, CRIM has been used in other countries where they don't have very strong mental health structure or system. And so being able to find people who are paraprofessionals, leaders, or anyone just who's interested in helping other people. And so they're there to guide them. So they're not therapists, just being able to know the skills so that they can help them understand it, be there to be supportive. So this is the definition of CRIM guides based on the Trauma Resource Institute. And so as teachers, we have to go through that training, but then we want to be able to help other people and then train other people to be that CRIM guide. And so which has been the work that I've been doing, because I'm the only certified CRIM teacher in our organization, which again, I'd love to be able to get more. So this is sort of my initial list, right? So I wanted to get our employee health nurses involved in it. So I met with them, just explained a little bit in terms of what I was planning to do. The clinical educators actually got their buy-in. And so I gave them a 2-hour CRIM workshop, and so that they understood it, because then I knew that they were at the very front, of helping with the new grad program, with any of the things. So I was trying to figure out, well, if you guys are doing some stress management things in any of your classes, let's figure out a way to embed CRIM in some of the classes that they were already doing. Of course, the inpatient clinical social worker, our chaplains, I also spent some time training them on the concepts, the CRIM concept. Our palliative nurses didn't quite succeed with that. I did meet with our palliative nurse director, and so I got her buy-in, but they just got so busy, and the time that we had scheduled to do their training just for them, they just kept canceling on me. And then of course the team leaders and some supervisors, we had one in-house interpreter, so which was crucial for me to really, from a health equity point of view, I wanted to make sure that we had bilingual Spanish speaking people who understand CRIM. And so I even met with our housekeeping staff. So I got myself invited to their meetings so that be able to help understand that. I trained one of our clinical social worker here in our clinic who's bilingual. So she became a CRIM guide so she could help me with some of our Spanish speaking staff. And which is what I mentioned, so I have a little bit more control here because I'm a manager in our outpatient clinic. And I oversee our behavioral health program. I also oversee our outreach program and our health workers. So I was able to train them as well so that they can use it with their patients and teach it with their patients. So this was my initial list of CRIM guides that, again, being able to identify, how can I get these people to help me spread the word. And then outside here, actually continuing the list. So one of our key people who is a connector is the director of our volunteers. And so she is a former, she is a nurse, but before she became the director of our volunteers. So she has been here for a long time. So a lot of people know her. And so she was a crucial person to be on board with that. So we also provided the CRIM training for our hospital volunteers. I happen to know one of the key faculty members for the Azusa Pacific School of Nursing. So she made CRIM class as an option for them to attend to meet as a requirement for their one of their community nursing assignments. So that worked out for us. The other part that we already have within our organization is we have partnered with the Apple Valley High School, their medical academy training program. And so being able to get them to include, and which just happened recently. So I'm actually going to be teaching CRIM for their medical academy at the Apple Valley High School starting next week. And then I'm pretty involved with the local breastfeeding coalition. So I provided a workshop for them as well. Again, also some of the nonprofit organization that we are partnered with. So you're probably wondering, why am I going outside? Because then that's part of my role as a community manager of community programs. But I think part of being able to embed, not just within the culture of our organization, it's just that whole language, because we are part of the whole community. So these nursing students are doing their clinical work at our hospital. And so the volunteers, all of these other people are kind of in and burnout of our system, our kind of our world here. And so wanted to make sure that I'm using their influence as well to be kind of embedding it from all different directions. That's why the slide deck that you see, I have all these different connection as a web, as a way to kind of help you understand that concept of a web. So really, as CRIM Guide, these are some of the set of questions that, asking them in terms of how can we really embed this in the community as well and use it in the community. So one, the hospital as a community, but the community, our hospital as a nonprofit organization, we're very community oriented. And so really essential for us to include them in any, in this whole process that we're doing. Let's see. So so for me, the lessons learned, I wanted to be able to share that. Of course, I mean, we kind of did expect a second wave, during the summer. It's kind of hindsight now, right? When there was a lull, we had already set up some classes that we wanted to be able to do that. And I wish we had an opportunity to really jam pack those classes during the summer before the second wave, because now we've had to cancel the classes that we had because they just can't get away, to attend any of the classes. So we're now trying to figure out other ways of making it available. So now we have, we're setting up just support group that is available, and hopefully be able to put in, some CRIM skills in those support groups that we have for our staff, both in English and in Spanish. So, I think one of the pieces for me is that I wish I also had the buy-in of our human resource department. So which at this point, very slow to try, their focus is on other things. And so not being able to get them involved in this whole process. And that's why you didn't see them on my list of recruiting for CRIM Guide. It's just, I just knew where they were at the time, and I wasn't going to spend my energy trying to convince them at this point. But if you have a good relationship with your HR and get that opportunity, I would absolutely do that. So we're still a work in progress. We had lots of great ideas of how we would do it. One of the idea we had for hospital week, which was of course canceled and postponed, but canceled again. We were going to have a wellness fair, and so each station was going to be a CRIM skill, and they were going to learn and pick up some goodies and all of that. So, so those are just different approaches, different ways of trying to embed CRIM skills and the concept. So I am done.
Great. I don't know if any questions came in. Allison, did you see any?
Sure, yeah. I'm just going to go ahead and share the questions.
Okay.
Starless asks, how long did you say it takes to change a culture?
So how long really would be 6 years on average, so that's why I knew that it would take a while. So that's why I needed to use this tipping point concept to at least create a movement. So I'm trying to create a movement right now so that I can hopefully kind of start, embedding some of these pieces and change the culture of the organization to adopt community resiliency as a way to help our staff manage burnout and stress.
Quite a few participants were hoping that they could get copies of these slide decks. Where can people find these?
I'll email mine to Laurie, share it out. So.
Okay, Laurie, you and I can connect.
Okay, I have some questions, and I also have. I'm going to put in the chat. We're having the second in the series. I have a number of questions still in the remaining time, but we are going to have the second in the series of webinars on healthcare provider wellness. This will be on December 16th at 3 p.m. Pacific. It's Dovetail Learning and the Center for Care Innovation, co-sponsored with ACES Connection. And it is entitled, We Are Resilient, Strengthening Resilience in Ourselves and in Our Patients. And I'm going to put it in the chat right now. I don't know. Did I get the link in, Allison?
Mm-mm.
Somehow links and chats don't always work, but we could also send it out if it's, let me try again. Or maybe you can find it, Allison, while I'm asking questions? I don't know. Link to it.
Yeah, I can send an email out to everyone who registered with the follow-up link.
Okay, that's great, because I want to just make sure everyone has that. But I was also curious, can you speak a little bit more about some of the things that you learned from this process?
Of trying to let people know about CRIM. Again, any opportunity I could, and giving them sort of like that preview of what some of those skill sets are, was very helpful, because then, people, it's like, well, I don't have time to attend the class, but then being able to show them some of those help now skills that Dr. Lawson was talking about and how to apply it, as a teaser, as a sample. You know how we like to go to Costco and get samples, so this was the sampling kind of thing for them. So I think, now is the time that people are wanting this. And so this is that whole context that I talk about. So before this, I don't know that I would have been able to convince our leaders to provide continuing education, to do CRIM. It would have taken me longer, but because they're so desperate and needing something to help our staff, that this is a good time to be able to let people know that there's the skills that we need to be able to help our staff. I think the lesson learned for me is that because I was wearing so many hats, that I needed to come back to my role here in the clinic. And so if there was someone else full-time who can help do this and implement it, that would be my recommendation. It's just that I needed to do my real job, work in the clinic, which we were going through a FQHC transition. And so it was just harder to kind of do both. And that's why if I had more teachers and CRIM guide, then it would have been more helpful.
And I'm also wondering, any of you can answer how, like, I'm thinking particularly in a fast-paced hospital environment, high stress, how do you see this happening on the ground? And do people help each other and work with each other to help guide them through it if they see somebody else who may be stressed out? Or I'm wondering what that looks like.
Well, what I kind of dreamed about was teaching a lot of people in the hospital, and we're in our second randomized control trial right now with a broad spectrum of hospital employees, teaching the 3-hour class, and then from those, some brave souls coming forth wanting to become CRIM teachers, and they did. But I was just envisioning almost like a squad of CRIM guides or teachers who could just do resiliency checks, cruise around, check in with staff about are they using the skills? How's it helped them? Maybe resource them on the spot. It would not be that hard. And I learned today by Dr. Navarro from you that just even having some well-trained CRIM guides who can't run a class, but they can do one-on-one. Mm-hmm. And so that's a brilliant approach. And I'm going to do something about that. I appreciate it so much.
Yeah, and one of the things that we really emphasize is the app, the iChill app, and so that has been helpful for all our CRIM guides to be able to use that because it's right there on their cell phone. And I really encourage our staff also to download the app and learn on their own. So that's another way for them to preview what it looks like, and then they can come to class or come meet with me one-on-one. So, but the app is a huge asset for us to use to show people what what it's all about.
It's like you have a menu of choices when you notice that you're dysregulated, you're upset, you're anxious. You can choose one of these skills. So the nurses in these dire clinical situations were using a lot of grounding. They were grounding on their own skin. They were noticing their scrubs, the texture of their scrubs. the ring on their fingers, rubbing their knuckles perhaps, noticing the support of the floor. You can do all those things in an instant, and you've reached up and grabbed your prefrontal cortex, and you're using interoception, which is that sensation sensing, and you will bring down your heart rate and your blood pressure because you've put yourself instantaneously into a parasympathetic state instead of just being reactive.
I also, I think we do have to wrap up. We're about a minute over, but I did have one question. Linda Grabbe, if you could talk a little bit about how over time the resiliency effect is expanded. You said something like that, and I was curious about what you meant.
Okay. So psychotherapists often learn these techniques. They have to hear difficult stories from clients. So they have to stay regulated, because if they themselves can be regulated, the clients will sense it and will calm down themselves. So those are mirror neurons. We know this works. So if we use our CRIM skills, I don't know, off and on during the day, it's not like meditation where you actually have to take 20 minutes and sit someplace quiet or do yoga on a mat. You can just do it off and on during the day. Notice the sensation of strength in your legs as you walk. If you're comfortable on the couch, feel it, sense it in your extremities. Where does it feel good? It's a language that some may be gifted at. I'm not, but we do have sensory receptors throughout our body, and we can start noticing sensations to the degree that it's comfortable. CRIM is entirely invitational. We never direct people to do something, only what they're comfortable with. So we can invite them. What do you notice happening in your body when you're smiling like that and talking about your grandchild? And then if they don't feel a thing, we can at least ask, well, do you notice any change in your heart rate or your breathing or your muscles? Anybody can feel those things. So even somebody with a serious trauma history who may have been fairly cut off from their bodies, this is almost like a portal to sort of be developing a sense of self. And through the 5 senses, I would say that's another portal. And noticing, like I said, your heart rate, breathing, and muscles, that's a beginning. And then maybe you can begin to sense more as well later on.
Well, I want to thank you all for taking the time to talk. You all have given information, or I guess in your presentations, people will know how to connect with you if they want to find out more about this. So we will be continuing this series. And if you have any particular suggestions based on your own healthcare situation of the type of webinar that you think would also add on to this for wellness, please write and let us know. So I want to thank you all again and enjoy the rest of your day.